Hi everyone, I'm Macy Walker, and today I'm going to talk about how nursing first started in colonial America. Nursing did not always look like it does today. There were no nursing schools, no license, and barely any hospitals. It was very basic and mostly done at home. In colonial America, most healthcare happened inside of the home. If someone got sick, their family members took care of them. There weren't many hospitals, and the few that did exist mainly cared for the poor people and the people that had no one else to help them. Women were usually the main caregivers. Mothers, daughters, and especially midwives played a big role. Midwives were trusted women in the community who helped deliver babies and care for the women and the children. Religion strongly influenced healthcare. Many people believed illnesses were connected to God's will. Treatments often included prayer along with herbal remedies and traditional practices passed down through the generations. Benjamin Franklin helped encourage the building of hospitals because he believed that communities had a responsibility to care for the sick. This idea helped lay the foundation for organized healthcare systems today. When we compare colonial nursing to modern nursing, we can connect it to the cues and competencies. First is safety. In colonial America, people did not understand germs or infection control. They didn't wash their hands the way we do now because they did not know bacteria existed. This caused infections to spread easily. Next is teamwork and collaboration. Even though nursing was informal, care involved teamwork, families, midwives, and religious groups that worked together to support the sick. Today, teamwork still plays a huge role, but now it includes nurses, doctors, therapists, and other healthcare professionals that work together as a unit to provide the best possible care for their patients. Another big difference is evidence-based practice. Colonial care was based on tradition and personal experience. Today, we base care on scientific research, clinical judgment, and patient preferences. Treatments were mainly based on home remedies. People used herbs, natural treatments, and advice that had been passed down through the generations. There wasn't specific research to prove what worked. Many treatments were based on belief rather than evidence. Today, evidence-based practice means we combine research studies, healthcare experience, and patient values to guide our decision. This is one of the biggest changes in nursing over time. Understanding the past helps us see how nursing evolved from tradition-based care to research-based scientific practice. There were many challenges during this time. Medical knowledge was extremely limited, sanitation was poor, people did not understand how diseases spread. There were also serious epidemics like smallpox and yellow fever, and these outbreaks caused many deaths and forced communities to start thinking more seriously about public health and diseases and disease prevention. Even though colonial nursing was informal, it helped build the foundation for professional nursing. Community-based care showed the importance of compassion, responsibility, and organized support systems. The structured nursing profession with formal education and standards did not develop until later centuries, but this time period was the starting point. When we look at professionalism, we can still see it in the colonial caregivers. They showed dedication, moral responsibility, and commitment to their communities. Even without formal training, they took their role seriously. Over time, nursing evolved into a recognized profession with educational requirements, ethical standards, and accountability. The AACN Essentials today emphasize professionalism, ethics, and lifelong learning. These standards grew out of the historical foundation built by the early caregivers. To end, I want you to think about this. How did the challenges nurses faced in colonial America help shape modern nursing standards? For example, because infections spread so easily back then, we now have strict infection control policies. Because care was unorganized, we now require formal education and licensing. History shows us that nursing improved by learning from its challenges. In conclusion, nursing in colonial America may have been simple and informal, but it played a critical role in shaping the profession. It laid the foundation for safety, teamwork, professionalism, and evidence-based practice that defines nursing today. And this is my reference page.